professor of medical oncology at Università Vita-Salute San Raffaele in Milano, Italy, where I'm directing the strategic research program on chronic lymphocytic leukemia, fully dedicated to patients affected by chronic lymphocytic leukemia, CLL. Chronic lymphocytic leukemia has a major impact on the immune system of patients affected by the leukemia, because indeed the leukemia itself is a leukemia of the immune system of a subgroup of lymphocytes, the B lymphocytes, and so the leukemic B lymphocytes expand at the expense of the normal B lymphocytes that are the ones that are able to produce the antibodies, the immunoglobulins against infections, viral infections, bacterial infections. On the other side, the leukemia itself is also affecting the other arm of the immune system, so the T lymphocytes that are able instead to destroy cells infected by viruses. And for some unknown reason at the moment, the leukemic cells that do not allow T cells to properly respond to infections. COVID-19, the infection by SARS-CoV-2 virus, had a major impact on patients with chronic lymphocytic leukemia because of their impaired immune system for a number of reasons. The first reason is that there is a limited number of cells able to produce antibodies against the virus. So for this reason, the patient do not respond well to the infection, but also do not respond well to the vaccination. So even if they are vaccinated, they are not protected as much as all other healthy individuals. On the other side, patients with chronic lymphocytic leukemia have typically many comorbidities due to the age, because the disease is a disease of the elderly. Median age of diagnosis 72 years. And therefore, having other comorbidities, we learned that the patient with cardiovascular disease, for example, diabetes, and so on and so forth, are those who more likely will suffer from consequences of the viral infection. For this reason, the patient needs to be more protected than other individuals. So they need to be vaccinated, of course, but as I said, they typically do not respond so well to the vaccination. So they need to remain protected, wearing masks, washing hands, and in particular, trying to avoid social relationship, in particular, keep distancing from the other individuals. But also we are lucky on a certain way, because now we have drugs and tools that can help to protect more our patients. And I'm referring to the antivirals, I'm referring to the antibodies that can be given after the exposure to the virus, but also before the exposure to the virus. So to prevent the infections, somehow replacing the vaccination when patients do not respond to it. As for many other drugs, there is always an issue of equity of access to these novel drugs and novel therapeutics that are very beneficial, in particular for the patient with immunocompromised system. So while in some countries these have been available since the first minute they were approved, in other countries this is still lagging behind, and therefore we should all try to campaign in favor of a wider access to these therapeutics for immunocompromised patients. Patients with chronic lymphocytic leukemia need much more to navigate in this particular season of the pandemic, because it seems that the problem is over, life seems to be back. Normal individuals are not wearing masks anymore, not keeping distancing, and everybody started again to travel and move around. For patients with the immunocompromised system, as patients with CLL, the situation remains still of relevance. One needs still to be very alert in order to navigate properly. Every one of individuals that are not affected by CLL or other immunocompromising diseases can be of help and can help navigate our patients in this very difficult historical period. Because first of all, they should keep in mind to keep distancing. So somehow they should not force people to shake their hands or embrace themselves or kiss each other, because this is, though expressing feelings, these are not necessary. In particular, can be dangerous in this particular period. On the other side is maybe they should also wear masks and consider that the less we spread the virus around, the better it is to protect, in order to protect the immunocompromised patients. Today is CLL Day, so we have to keep our attention on this disease, chronic lymphocytic leukemia, and even if we are not affected by it, or we don't know anyone affected by it, we should think that there are patients that have this disease that do not allow them to have a regular life nowadays because of the virus, because of the risk of COVID. And therefore, we should all be aware of this and try to help by vaccinate ourselves, and also try to limit the spread of the virus by wearing masks when we can, by avoiding social contacts, and trying to wash hands as frequently as possible. Please consider those living with CLL.